On this Friday night, Alberta's alarming COVID-19 situation, the mounting frustration and exhaustion.
Last week was probably the toughest week that I've had of my career.
An all-time high caseload and low restrictions. The potential deal that could set Huawei's CFO free and the two Michaels. New charges in the Nova Scotia massacre, the accusations against the gunman's common-law wife, and trying to profit during the pandemic.
It's been a good way to test some of the new digital innovation.
When an off year forces small businesses to go online.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. Lots to get to on this Friday as we track the spread of COVID-19 in Canada and efforts to get it under control. The federal health minister says Canada could approve its first vaccine in the next week to 10 days. But for now, there is no relief for regions with skyrocketing case numbers. In places like Alberta and Manitoba, hospital beds are filling up fast and healthcare workers are struggling to keep up.
I cannot emphasize enough the impact that these COVID numbers are having on our staff throughout the system. They are tired, they are fatigued, they are stressed by the changes and the intensity that is upon them.
Here's the national picture. Over the last week, on average, there have been close to 2,500 COVID-19 patients in Canadian hospitals. That includes nearly 500 people in critical care. And on average, in the last week, 87 Canadians died of COVID-19 every day. With case numbers climbing fast, Canada has hit another grim marker in this pandemic. More than 400,000 Canadians have now tested positive for COVID-19, and more than 12,400 Canadians have died. Every corner of the country has felt the impact of the second wave, but in Alberta, it's a full-blown crisis. The province reported more than 1,800 new cases today for the second day in a row. As of tonight, there are 533 COVID-19 patients in hospital, 99 of them in intensive care. Heather Yourex-West reports on the increasingly desperate situation in hospitals and the political decisions that led to this crisis.
Inside Alberta's hospitals, exhaustion is setting in.
I can tell you that last week was probably the toughest week that I've had of my career.
And yet there is little time to rest. Record-breaking new case counts will mean more COVID patients will soon need hospital care.
The health minister spoke with her counterparts last night and assured them that the federal government will offer all support needed, especially in Alberta, where the numbers are rising alarmingly.
The restrictions in Alberta continue to be some of the most moderate in the country and have remained so even as case numbers rise. 10 days ago, a ban took effect on private indoor gatherings. Business and school restrictions began last Friday. In the week since, new infection numbers have soared, but the province's top doctor says it's too soon to say if the measures have failed.
The bulk of these numbers that we're seeing today would be from transmission events that would have happened prior to those restrictions.
But during a Facebook Live event Thursday, the Premier said any new measures would again be targeted.
I suspect that if we do that, those restrictions will be likely geographically focused.
Alberta may lead the country in active cases now, but last spring it was a different story. The province's response was the envy of the country, but in May, the Premier's tone seemed to change.
The average age of death from COVID in Alberta is 83. And I remind the House that the average life expectancy in the province is age 82.
Since then, the Premier has talked about balancing the needs of Alberta's economy. But as case numbers rise, business owners are growing frustrated too.
I feel if he would have done this in October, if we would have had, when we knew the numbers were coming, we could see what was coming ahead. If we would have maybe done this earlier, we probably would have had our Christmas season.
What is the best course of action, today can change. Depending on data, depending on events, depending on things that you really have no idea about.
The former health minister knows what it's like to govern through an emergency. He says decisions can be difficult, but leaders need to be able to change course when required, particularly when lives are on the line. Heather Yourex-West, Global News, Calgary.
We have an update tonight on an escalating COVID-19 outbreak on a remote First Nation in northern Manitoba. Chief Eric Redhead of the Shamattawa First Nation says 133 people have now tested positive for the virus, and his community is struggling to get the situation under control. He says a gymnasium set up to help people self-isolate is full, and there are now daily flights carrying sick people to Winnipeg. Redhead says he wants the military to be sent in to help. That hasn't happened yet. The federal government says it's working to help the community using regional resources. The federal government still won't commit to a firm date for when the first Canadians will get a COVID-19 vaccine. But Ottawa continues to prepare by buying more vaccines and supplies. The goal is to increase delivery capacity and fine-tune recommendations for who will be first in line. Here's David Aiken.
For most Canadians, the first vaccines cannot come soon enough.
Protecting you and your family and defeating COVID-19 is our top priority.
So Ottawa is getting the country's house in order for the biggest mass immunization program in history. First order of business, buy enough vaccines so that everyone who wants one can get one. On Friday, Ottawa said it had arranged to get another 20 million doses from vaccine maker Moderna.
This will bring Canada's total allotment of this vaccine to 40 million doses to be delivered in 2021.
Still, decisions will have to be made as to who gets one first. A federal task force issued revised recommendations Friday saying first in line should be residents and staff of any retirement home, long-term care facility, or chronic care hospital. Then, anyone over 70, starting with those over 80 and then working backwards towards the 70-year-olds. Then, healthcare workers with a focus on those on the front lines. Next, adults in Indigenous communities where the spread of the virus could have disproportionate consequences. Still, it will be the provinces, not Ottawa, that will have the final say on this vaccine priority list. Finally, Ottawa needs transportation help to get these vaccines to provincial and regional healthcare providers.
Specific logistics will be required to keep the doses at very, very cold temperatures.
So, Ottawa signed deals Friday with FedEx Express Canada and Innomar Strategies to deliver the vaccines. But there is still much more to be done before Canada is ready to accept that first shipment of vaccines. It's work federal officials say they are confident of finishing by the new year. David Aiken, Global News, Ottawa.
Job growth across Canada slowed last month as the pandemic picked up steam. Statistics Canada says the economy added 62,000 jobs in November, compared with 84,000 in October. The gains were mostly focused in full-time work with the addition of 99,000 jobs. But those gains were offset by a decline of 37,000 part-time positions. Canada is still down 574,000 jobs from before the pandemic. November's unemployment rate stands at 8.5%. Many Canadians are unemployed right now because businesses are struggling to stay open. But some store owners are coming up with creative changes to save the holiday shopping season. Mike Drolet will have more on that later on Global National. The economic recovery in the U.S. is slowing as COVID-19 cases surge south of the border. Employers added 245,000 jobs last month, far short of the 440,000 economists predicted. The unemployment rate edged down to 6.7%. The virus is breaking daily records in the U.S. for deaths, hospitalizations, and new cases. Close to 280,000 Americans have died from COVID-19 as the country faces a rise in infections from the Thanksgiving holiday. U.S. President Donald Trump still hasn't conceded the election, but President-elect Joe Biden is now laying out his strategy to fight the pandemic. Jennifer Johnson reports.
With hospitals and morgues running out of space, President-elect Joe Biden says he will ask all Americans to wear masks starting January 20th, the day he's inaugurated.
Not forever, 100 days. And I think we'll see a significant reduction.
Biden and former presidents Obama, Bush, and Clinton are promising to get vaccinated publicly to encourage others. A new study shows confidence in the safety of the vaccine is growing. 60% of Americans now say they will get the vaccine.
Please don't let yourself be biased. Just open up your mind, look at the facts, look at the data, and then make up your mind.
Vice President Mike Pence was briefed on vaccine distribution at the Centers for Disease Control in Georgia.
Within 48 hours from the FDA's approval, we could be vaccinating people literally in all 50 states.
But already there are issues. Pfizer's plan to ship 100 million doses by the end of the year has been cut to 50 million worldwide after problems getting raw materials. Hospital officials are also concerned about distribution snags.
The biggest challenge we have is we don't know what we don't know.
As Americans anxiously await a life-saving weapon, Dr. Anthony Fauci, Biden's new chief medical advisor, warns this latest COVID-19 post-Thanksgiving surge hasn't peaked yet.
The thing that concerns me is that it butts right on the Christmas holiday as people start to travel and shop and congregate.
California has just imposed its strictest lockdown since the pandemic began. Colleges in Maryland are graduating their nursing students early as hospitals face record numbers of patients.
Things were steady, and then all of a sudden, boom, and it just seems to be nonstop.
Millions have their eyes on Congress as it continues to work on a $900 billion coronavirus economic aid package. President Trump says he will sign the bill once it passes, extending unemployment benefits to millions and greater protection from evictions. Jennifer Johnson, Global News, Washington.
The global tally of COVID-19 cases has hit a staggering new record. Infections have now topped the 65 million mark, and more than 1.5 million people have lost their lives. In the last week alone, over 10,000 people died every day from the virus worldwide. In Italy, tight new restrictions are now in effect for the holidays. They include a strong recommendation against hosting guests. Ski resorts are also staying closed over Christmas. There's a ban on travel between regions starting December 21st, and there will be no midnight mass. Italy is seeing a downward trend in infection rates, but is struggling with a high death toll. 814 people died from COVID-19 in the last 24 hours. The U.S. Department of Justice is refusing to comment on reports a plea deal could be in the works for Meng Wanzhou. The Huawei executive was arrested in Vancouver in 2018 at the request of the United States. She's accused of violating American sanctions against Iran. The possibility of a legal arrangement raises hopes two Canadians held in China in apparent retaliation could be released. But as Abigail Beeman reports, Meng has to carefully weigh her options.
The deferred prosecution agreement reportedly being discussed between Meng Wanzhou's lawyers and the U.S. Department of Justice could see her return home to China, but she'd have to admit to wrongdoing. According to the Wall Street Journal and Reuters, she isn't prepared to do that.
She should not admit to any wrongdoing if there was no wrongdoing. She followed the rules. If she admits to wrongdoing just to get out of Canada, her future journeys to various countries in the world will be denied.
Meng's lawyers told Global News they wouldn't comment. The Prime Minister wouldn't talk about a possible deal either, but Justin Trudeau did weigh in on the reasons this case carries so much weight for Canada. Michael Kovrig and Michael Spavor.
For almost 2 years, we've been working extremely hard to bring home these two Michaels. It is an absolute priority for the government. I won't be commenting on any of the recent reports.
Beijing accused Canada of playing a role that is not honorable, calling it purely and essentially a serious political incident. And on politics, there is a question of how much this has to do with President Donald Trump's looming end of term.
The most likely explanation is that the Trump administration is concerned that Joe Biden would decide to unconditionally withdraw the extradition request.
Charles Burton says that route would be better for Canada.
If the deferred prosecution goes through, then Canada still has to negotiate with China for the release of those two Michaels, and that would probably mean that we'd have to make some sort of concessions to the Chinese government that we normally would not like to do.
Burton is leading the Canadian arm of a new global initiative, #FreeChinaHostages, calling on people to mail Christmas cards for Kovrig and Spavor to the Chinese ambassador in their country. Burton doesn't expect the letters to reach their intended recipients behind bars. Rather, it's about sending a message to the Chinese government. Abigail Beeman, Global News, Ottawa.
An uproar over the Prime Minister's remarks. Coming up, why India is angry. 3 people are now facing charges in connection with April's mass shooting in Nova Scotia. RCMP say the gunman's common-law spouse, 52-year-old Lisa Banfield, is among 3 people charged with unlawfully transferring ammunition. Police say those charged had no prior knowledge of the gunman's actions. 22 people were killed in several rural Nova Scotia communities. Canada's High Commissioner to India was scolded today over Prime Minister Justin Trudeau's remarks in support of Indian farmers. In a statement, India's Ministry of External Affairs says comments by Trudeau constitute an unacceptable interference in internal affairs. It goes on to say such actions, if continued, would have a seriously damaging impact on ties between India and Canada. Today, when asked about his remarks, Trudeau doubled down.
Canada will always stand up for the right of peaceful protest anywhere around the world, and we're pleased to see moves towards de-escalation and dialogue.
On Monday, during an online event, Trudeau said he was concerned about the protests in India and that Canada would always support the rights of farmers to be heard. Tens of thousands of Indian farmers are demonstrating against new laws they say will subject them to corporate exploitation by driving down product prices. Still ahead, getting a potential vaccine here from Switzerland and the Canadian helping to make it happen. Moderna is one of the leading vaccine candidates waiting for Health Canada approval. In anticipation, its 2 manufacturing plants, one in the U.S., the other in Europe, are operating around the clock trying to meet global demand. As Carolyn Jarvis reports, the entire supply chain is getting ready, starting with a Canadian at the top.
In a quiet Swiss valley, a Canadian is leading the charge to get vaccines back home.
What's the question you get asked most frequently?
When is it going to arrive? When can we see it?
Nicolas Charnet is the head of international manufacturing and distribution for Moderna, maker of one of the leading COVID-19 vaccine candidates. Moderna teamed up with manufacturing firm Lonza, based here in Switzerland, to create a second production hub outside the U.S.
What does your family back in Sherbrooke say?
Hey, they're all behind us. They're telling me, hey, how fast can we get this? Because we want to see you. We want you to travel and come and see us again.
Construction on Moderna's 4 production lines is still ongoing, but it's expected this site will produce upwards of 300 million doses by the end of 2021. And when combined with its manufacturing plant in the U.S., Moderna says it could make as many as 1 billion doses next year. If it's approved by Health Canada, Canadians will start seeing that supply in early 2021.
Canada is one of the countries that move very, very fast in securing vaccines with us. It's one of the first countries, or one of the top countries to receive our supply also.
From Switzerland, Moderna's vaccine will be sent to Spain to the company Rovi that will put it into vials. It will then be shipped to a central depot in Canada managed by the federal government and distributed to the provinces.
They will then coordinate the onward flow of vaccines to those points of administration based on their internal plans and resources.
Unlike Pfizer's vaccine, which requires ultra-cold storage at -70 Celsius, Moderna's needs a conventional lab freezer at -20.
These are all going by truck out to, whether it's out to Vancouver or if it's out east to Newfoundland, it's all by truck.
But until the vaccine is approved, all eyes are here, on the town beneath the Alps, where the vaccine is being made.
On your end, it's coming.
Yes, it's coming. Yeah.
Carolyn Jarvis, Global News, Toronto.
And Carolyn sits down with the head of Toronto's immunization task force for an exclusive interview on how Canada's largest city is preparing for the vaccine's arrival and deployment. You can see that on The New Reality with Donna Friesen on Saturday, right here on Global. Seasonal shopping solutions. Up next, how small businesses hope to beat big competition. Holiday shopping could be a lifeline for some Canadian businesses. With so many closed by pandemic restrictions, shopping has moved online. That shift is hurting local retailers, while giants like Amazon shatter records. As Mike Drolet explains, that's inspired some creative solutions from small retailers to beat the competition this Christmas.
There are few events in Toronto that compare to the Distillery District's Christmas market. 750,000 visitors turned the stalls and stores into a giant festive zoo. The contrast to 2020 is what you'd expect it to be. With less foot traffic and then a lockdown, Melissa Austria of Got Style Menswear had no choice but to get creative. So she now has a more robust website and is offering virtual shopping through Instagram and Facebook. Nothing is off the table.
It's been a good way to test some of the new digital innovation that we were planning on doing, and now we're just trying everything at once.
But not all businesses, particularly those geared towards the holidays, have the option to adapt. The annual sleigh ride in Armstrong, BC was canceled this year. Organizers just couldn't see running it with restrictions. And retail needs those horses. A recent survey found that 30% of businesses are seeing normal sales and 60% are fully open. And that has led to some unfestive phone calls at the Canadian Federation of Independent Business.
I can't really give you the reaction without swearing.
The Toronto bar Miracle sells Christmas, or at least it did. Opening day is when the current lockdown was announced, so all they can do is sell cocktail kits online and cross their candy canes they'll be able to open closer to Christmas.
The quote at my home bar, Civil Liberties, for the last, 9 months now has been high seas make strong sailors, and I feel like we're going to have a really strong, vibrant industry on the other side of this.
It's that other side that led to the creation of Bag of Toronto, a project created by Nick Millam and Derek Liu to help small business. Neither works in retail, nor do they profit from the proceeds of the curated bags filled with local products.
Helping people that we don't even know or business owners that we don't even know is truly satisfying, I think.
The only profit they hope to see is a happy and healthy holiday shopping season. Mike Drolite, Global News, Toronto.
And that is Global National for this Friday night. I'm Robin Gill. Tonight, Your Canada is from inside the Anne of Green Gables Museum in Kensington, Prince Edward Island. We'd love to see your corner of this country, so please send us your photos to viewers@globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.